We're here on a campaign this morning. It's a campaign which leads us to travel up and down the state. It's a campaign to parents. It's a charge that every parent should accept, and that is to be sure that their child has health insurance. As a parent myself, I can say there's almost nothing more important than making sure that my own kids have the ability when they're sick to be able to go to a doctor, to have that health insurance coverage. And the law that we're talking about this morning enables all California parents to assure that for their kids. So what's at stake here? Last year, when federal health care reform was passed, it created an opportunity for us here in California. So we implemented a new statute, and the law that I wrote has two features that include but go beyond the Federal Health Insurance Reform Act when it comes to kids. That act, as has been mentioned, assured that kids with pre-existing conditions would be entitled to get health insurance coverage. Here in California, we've gone beyond that. We've said, first, that the cost of that insurance for a child with a pre-existing condition can be no more than twice that of a healthy child. And the other provision is one which Dave alluded to a moment ago, and that is when federal health care reform passed, insurers throughout the nation were suggesting that they might no longer offer policy to children in states so they could avoid this obligation. Well, here in California, we said, you can make that choice, but if you make that selection, you'll be forbidden to write health insurance policies for individuals in California for 5 years. According to published reports, that led insurers to be doing the responsible thing and making their policies available. That, however, is only a promise as good as the action that we're urging parents take today. We have 2 more weeks until March 1st in which take advantage of this open enrollment period. 2 crucial weeks that could literally make a life or death difference in your child's life. Health insurance, so important. Who are we talking to today? We're talking to parents whose own health coverage might only pertain to them and not cover dependents. We're talking to parents who are not qualified for Medi-Cal, but for whom private insurance, because, for example, of a child's pre-existing condition, was either unavailable at all or just too expensive. We're talking to parents who may have allowed their children's health insurance to lapse. Well, notwithstanding that being the past, today every parent has a new opportunity for a beginning that will ensure their child is off to a wonderful start in life.